Thank you for joining us today on the program, Healthy Living. I'm Adesuwa Osa-Owage. Today we want to talk about you, woman. How are you taking care of yourself? Do you know that cancer kills? And cervical cancer is one of the commonest cancers that kills women. And most women don't know. We still believe in this God forbid syndrome. It's not my portion. If it's not your portion, whose portion do you want it to be? Mine? No. So we have to take care of each other. So if you're ready for me, I'm also ready for you today, because let's talk about our health. So we're going to look at all the things you need to know about cervical cancer. You know, the other day we came, we just talked about it. We danced around cervical, we danced around breast cancer, just for you to have a little bit of knowledge of what is happening with you. Some women don't even know. Unfortunately, presentation usually comes late when it is at stage 4, or let me put it this way, like quarter to go. We don't want it to be like that for you, okay? We want you to live. So I have 2 doctors in the house, and they're going to be talking to us about women, pap smear, and cervical cancer, everything that you need to know. So join me as I make welcome. Let me introduce the guy first, okay? I want to welcome Dr. Ipomosa Obahiagmo. He's an associate professor and consultant pathologist from University of Benin, UBTH. A pleasure to have you join us today, okay? I'm really happy that you're with us. So, I also have Dr. Ehizogi Adeyemi. She is the Director of Medical Laboratory Services, University of Benin Teaching Hospital. It's a pleasure to have you join us today.
Thank you very much.
Okay, we'll meet again.
Yeah.
I did say that I was going to go away with this blouse, so I get you something after the program. All right, doctors, let's look at what we want to do today to help the woman, to help me, to help you, to help every one of us, to help your sisters and to help your mothers. And of course, you don't want to see a woman who is down with cervical cancer. You don't want to see, because even you will cry. All right, so I'm going to ask Dr. Obahiagmo now, what is cervical cancer and why is it important for women to be aware of it?
Thank you very much.
You're welcome.
Cervical cancer is what we call a malignant, tumor affecting the cervix, which is the neck of the womb of the female. Okay, we have certain situations that lead to the growth of abnormal tissue in that region of female genital tract called the cervix.
Okay,
and it is called cancer because it's capable of not only growing in that spot of origin, but can also spread through the blood, through the lymphatics to distant sites, and that is how it becomes a threat to well-being and to life.
So why is it important for a woman to know about this?
Well, because we know from all our research that cervical cancer is the second commonest cause of cancer death among females in this environment. It may not be so in other environments where cervical cancer screening programs have been very successful, more successful than what we've been able to achieve here so far. But in this environment, behind breast cancer, cervical cancer is the second commonest cause of cancer deaths. So for that reason, every woman deserves to know about cervical cancer, how to screen for it, how to prevent it, what the risk factors are, and I believe a lot of the stuff we're going to be talking about here this afternoon.
I'm particularly happy that you're a man, and then talking to us about this, we encourage other men to encourage the female in their lives, whether your mom, your sister, your daughter, any other person. All right, let me talk with Dr. Adeyemi now. Let me ask you this question, doctor. I want you to explain to us the role of pap smear in the early detection and prevention of cervical cancer.
Thank you very much. Pap smear is a procedure used basically in the laboratory where smears are collected from the head of the uterus, as the pathologist had said.
So you go inside?
Yes, yes. And basically it's collected by use of the speculum. The speculum is used in our various clinics or designated clinics to open up the cervix, through the vagina. And once the speculum is inserted and the vagina is, once the speculum is inserted through the vagina, you can see the cervix clearly. And with the aid of what we call a speculum or a Severus brush is inserted through the speculum to collect sample or specimen from the cervical region.
Okay.
And this is brought to the laboratory for analysis.
Is it painful?
No, 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 no. It's a painless procedure.
Okay.
It's a painless procedure. Once the samples are collected, immediately they are placed in what we regard as fixative.
Okay.
And with these fixatives, they are transported to the laboratory.
Okay.
It is when it gets to the laboratory that we subject it to other processes that makes it easy for the pathologist to be able to read and make a diagnosis.
Okay. Yeah. So when the results comes out, what happens?
When the result comes out, the patient either collects or the clinician sends somebody to pick up the result from the laboratory. So the patient goes back to the clinician who does a follow-up. So whatever the diagnosis is, the clinician knows what to do. In all cases, when they find some diagnosis they don't understand, they refer back to the pathologist who guides and advises them on what they need to do. Okay. But once a patient is diagnosed, the clinician knows what to do to treat and manage the patient.
So at this point, when a patient is diagnosed and early steps are taken, is it what the wife for the patient?
Yes, yes, it is. There are three stages. Okay. We have the CIN1, the CIN2, and the CIN3. The pathologist will elaborate more on this.
Because I'm looking at you now, looking at CIN, it could just be anything for me.
He will explain that further, because that's more of his field.
Okay.
So whichever one the patient presents with, they will be advised on what next to do. But as somebody working in the laboratory, a med lab scientist, I know that we could say the CI1 is safer, could revert back to normal with use of normal antibiotics. It could be due to an infection that has presented with that CIN1. But once it's now CIN2, CIN3, those usually are the advanced stages. Usually a cone biopsy or a biopsy could be collected. Again, it's sent back to the laboratory for further tests to diagnose if it's really cervical cancer.
So all of these technicalities are just for the pathologist and
the medical laboratory.
Okay, now let's talk about the one that concerns the ordinary woman on the street so that we don't go too far. Now, Dr. Bayadon, what are the common misconceptions about cervical cancer and pap smear that you have encountered in practice so far? You know, women were very stubborn when it comes to things like this.
Well, I would say women have better health-seeking behavior generally than men.
Really?
Yes.
Fantastic. That's the path for women.
You know, as for misconceptions, the first one is many women think it's painful. They think it's painful, and so they are afraid to go for the procedure because they are worried about the pain they might feel. But it is a relatively painless procedure. Okay. Okay. The process of specimen collection does not involve, you know, dilating the cervix, you know, that is widening it, or opening it forcefully, no. It only involves visualizing it, that is inspecting it, and then using a very soft brush or a spatula, as the case may be. That's a small wooden instrument, a soft wooden instrument, just to, we use the word exfoliate, that is brush off some of the cells lining that area of the tract.
Okay, so you don't cut?
No, we don't cut. No, it's not invasive. You don't get to cut. You don't bleed or anything like that, assuming there is not already a bleeding lesion there. Okay. So our interest is just to, you know, brush off some cells that will be processed in the laboratory and viewed under the microscope, and they'll be able to tell of what sort of cells, you know, they are, whether they are precancerous cells or they are frankly cancerous cells, as the case may be. Another misconception people may have about it is that they are worried about maybe the privacy aspect of it, because it's in the sensitive area, private area of the body.
And there might be a man who wants to take the samples.
It could be a male nurse, could be a male doctor, you know, so they are kind of shy, you know, to come for it. But when you look at the benefits of screening for something as deadly as cancer, I think it's far outweighs, you know, that consideration of, you know, shyness or the shame of having to expose oneself. Moreover, in any hospital setup, you know, there's adequate privacy and a chaperone to guarantee, you know, privacy in case of an opposite sex healthcare provider. For instance, if it's a male nurse or a male doctor, you know, collecting the specimen, there will always be a female chaperone, maybe a female doctor or a female nurse, okay, to protect the privacy of the patient. So that is really not a worry, okay?
Okay, okay, so for those of us who are very shy, doctor have explained the process. So please, all of this would not cost you anything. But if you want to do otherwise, you may just end up killing yourself. Dr. Adeyemi, how often should a woman go for pap smear? At what age? At what time? You know, should a woman go for this? And how often should a woman do it?
Basically, when a young lady becomes sexually active, she has to ensure she does the cervical smear.
Even if she's 11?
Even if she's 11.
Because some young girls are active, even at 9.
Yeah. Yes, we have people having children age 9 and all that. So once a young lady becomes sexually active, there is a need for her to do a pap smear. And then young ladies, well, that's advice that could come later. Should avoid multiple partners too. Because multiple partners, you could get infected. And the virus implicated presently is a human papilloma virus. Though we also have the parasitic protozoa, Trichomonas vaginalis has also been implicated. But the most serious and most dangerous is the human papilloma virus, which is
and condom cannot keep that at bay.
Yeah, condom can. So protective sex, of course, will be recommended if the need, of course, is very necessary. So it could prevent, because once there's no direct contact, there will be no infection. So there is also the need for women in their childbearing ages to regularly go for a checkup. Okay. We sometimes advocate for those 40 and above routinely, twice a year.
Okay.
And then the older they get, it could be reduced to once depending on the outcome of the earlier pap smear done. Because if the outcome of the earlier test done indicates the need for the clinician to be worried, the patient might be required to do it every 6 monthly, depending on the initial finding. But if there is none, a woman in a childbearing age should go for a pap smear at least once a year.
Okay, Dr. Obayagwan, while you were talking, you talked about advanced countries where cervical cancer does not really kill anymore because of, that is, if they present early, because of the kind of technologies that they have there. What happened to us in this country? Is it impossible for us to get to that point? We pride ourselves as the giant of Africa. Why is it that we don't have these technologies? Why is it difficult to have all of this in our hospitals?
Okay, let me begin by saying that it's not really so much of technology that puts them ahead of us in terms of the control of cervical cancer. It is that the cancer screening programs have been more put to use, have been better articulated, have been better administered.
Over there.
The health-seeking behavior of people over there, you know, is better than what we have here. The level of ignorance and illiteracy, you know, is less there. The public overall is better enlightened as to, you know, the need for this screening, and because of that, people tend to present, you know, routinely for screening. In fact, there are systems whereby people are reminded that, oh, your date is due, and you come for your screening. And so the whole thing about cancer is early detection. It's all about early detection. You know, fortunately in cervical cancer, we have what we call precancerous conditions. Cancer doesn't usually start as cancer. There are usually changes induced by the infecting virus called human papilloma virus that begin to show in the cervix, and that can be picked up, you know, in the laboratory when we examine cells from the cervix, such that we can know that, okay, this person is on the way to cancer because they have what we call a precancerous condition that is not yet a cancer. At that stage, you know, definitive treatments can be administered, you know, such that the patient doesn't ever get to where they have cervical cancer. And because of that, you know, being successful in advanced countries, we have a very low rate of cervical cancer, which translates to low mortality from cervical cancer compared to this part of the world.
So how can we bridge it here in this part of the world?
We have to really improve on public enlightenment. We have to create more awareness, and then we have to ensure that we link cervical cancer screening to the benefits of comprehensive health insurance.
Okay.
You know, where you have comprehensive health insurance, people are not bothered about the costs of the procedure, where all these misconceptions have been cleared. You know, people come freely, they come on schedule, and then precancerous conditions can be picked up early, and you can avoid any progression to cervical cancer.
Fantastic.
Another thing that has been successful in advanced countries too is vaccination.
Vaccination.
There is now a vaccine against the virus that causes like 99% of cervical cancers, okay, which is human papillomavirus, okay? Now, when that vaccine is used before a lady becomes sexually active, she's prevented from ever having that infection by that virus. Yes, the success rate is remarkable.
Wow.
Yes, there's a very, very high chance of preventing, you know, the virus from ever infecting.
But people are asking questions that this vaccine is to make African women less productive.
Oh, that's another misconception that is worth noting. I thank you for bringing that up.
Because I said that, no, this are Igbo people, they don't make we born again, you know, they don't want us to have more kids like that, like that, like that.
Vaccinated, and they have had as many children as they wanted to have. The HPV vaccine is not a threat to fertility in the female at all. It is against the virus to protect, to build the immunity against infection by that virus. The thing is, if that virus will not get into the female genital tract, the chances of cervical cancer developing are almost zero. Even those changes of precancerous situations don't even occur. All you have when you do a pap smear will be normal findings. Yes, that's why they have succeeded.
Okay, now the age range, I'm very particular about that age range before a woman becomes sexually active.
Yes.
What if the woman is already sexually active? Isn't there hope?
Okay.
Let me throw that to Dr. Liemi.
There is hope. There is hope. That is why we encourage women to go for the cervical screening.
Okay.
Before you can be admitted, first of all, let me inform that the vaccine is available.
Yes.
Okay.
It's available in the hospital. And you need
all hospitals or only government hospitals?
For now, I think it's government hospitals.
Okay, and it's free?
No, it's not free. It's not free.
No, you like free
Presently, it's not being subsidized.
Well, it's expensive, but
it's expensive, but it's worth it.
Yes.
So for women,
that's the vaccine for women who are already...
For all, both the young lady who is not sexually active and the lady who's already sexually active, or women in childbearing age. So what they are expected to do for the women, there is hope. Okay. They are supposed to go for their screening. It is the screening, because before you can be administered the vaccine, you are to present a report that you have done your pap smear. Because it has to be ruled out that you don't have this HPV or any of these precancerous cells the pathologist mentioned. So I want to encourage women that there is a need for them to first of all be screened. Once they are screened and they have this certificate in quotes that they are free, then they can go for the vaccine. And the vaccine, I understand, is in 3 doses or phases, and they must complete the phases.
And those 3 phases within a year?
Yeah, within a year. Within a year.
So you spend 2 months apart?
Yes, 2 months apart. Then for those that are not sexually active, like the younger ones, they will just take 2 doses. Because I recently had to take the vaccine along with my daughters. Wow. And we paid for it, and we got vaccinated. So it's something that I think most mothers...
So what's the price range?
Am I supposed to disclose that?
Well, let's just know now, between so amount and so that some of us that want to go and start saving towards it, we'll go and start saving.
For myself and my 3 children, we looked about 200 and something thousand. Okay. That was what we paid. You know,
okay, that's not too much to save yourself from cervical cancer, because you just don't want to see somebody suffering from cervical cancer. It can be very, 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 very disheartening. Now, somebody who is already down with cervical cancer, what's the way out for that person?
Okay, if it's still early stage cancer,
like
surgical intervention, stage 1 especially, surgical intervention can be done.
And that will cure it?
Yes. Stage 1 implies that it's still confined within the vicinity of the cervix, such that if what we call a total abdominal hysterectomy, that is a removal of the womb and the cervix, with the cervix, because there's some cervix that spare the cervix, you just take out the whole seat of the cancer, and then it is forever cured. But when the stage is advanced, which means the cancer has spread from the cervix to other sites within the body, Surgery alone will not be the only modality. Okay, other methods like radiotherapy will have to be done, and there is no guarantee for cure. The only guarantee for cure is early detection, early diagnosis, and curative surgery, which is only curative at the early stages of the disease. So you see, you have prevention, a precancerous situation, early stage cancer, but beyond that, you can't do too much about it. You can't guarantee so much about what the prognosis is going to be for the patient.
Okay, how about somebody who is yet to have a child? Because Dr. Bayagmos just said that a total hysterectomy will cure everything. What about a woman who is looking forward to having kids but is down with this deadly ailment and need to remove everything like total hysterectomy? Is there partial hysterectomy?
There's what we call a subtotal hysterectomy.
Okay, subtotal. Can the woman still have kids if you do a subtotal?
Once you've done any form of hysterectomy at all, it's no longer possible to have kids. But there are other options like adoption or surrogacy.
Me and you, an African person, you know how it is with Africans. So,
it's life first.
So what about the woman who wants to have kids? Can she save her eggs?
Yes, she can.
Is there something she can do?
She can save her eggs. Okay. IVF, storage, eggs, fertilization later, fine. But in most cases, before total hysterectomy is done, the clinicians or the obstetrician and gynecologists or oncologists usually take into consideration the age of the patient.
Okay.
Because the age of the patient is a very significant determining factor if you are going to do this. And like the pathologist said, the extent of spread is a major factor. So the long and short of it all is early detection, which is regular screening.
Okay.
That takes care of it all.
All right. Our time is up. I wish we could go on and on and on. Dr. Adeyemi, thank you for fun. You have something to say?
No.
Okay. Dr. Bayagma, you want to say something by way of advice? Or?
Okay.
I would like to advise every woman out there who is not already participating in regular cervical cancer screening, that you need to be aware that cervical cancer is the second commonest cause of cancer death, just closely following breast cancer from studies done in our environment. So you are encouraged to go out there to the hospital and enlist yourself in regular cervical cancer screening programs so that if there are any changes, they can be picked up early and you can maximize the treatment modalities that are available to us. Cervical cancer still kills, but it is a cause of preventable cancer death.
Okay. Then to also help our women, majority of our churches are made more of women. Church leaders should encourage their women. They can liaise with the department to routinely screen their women. Because once they do this, it will also help the women in their various organizations. Oh,
that's fantastic. Thank you, doctors, for finding time to be with us on the program, Healthy Living. Doing your pap smear, going for routine check is better than going to spend so much money at one eatery or the other, or for one ashwebi or the other. Like they will say on the street, woman, borrow sense. We'll see you again next week. Bye-bye.